I think we'll go ahead and get started. Good afternoon. Thank you for joining us today. I'm John Hill, the President and CEO for Bozeman Health. I'm joined today by my colleagues, Callie Kujawa, our COVID-19 Incident Command Lead, Vicki Grenewig, the Chief Nursing Officer, Dr. Mark Williams, our Chief Physician Officer, and Darcy Benson, our Chief Administrative Officer, all for the Bozeman Health Executive Team. After I share my remarks today, we will open it up for the team to be able to take any available questions. 3 weeks ago, based on the best information we had available to us at the time, Bozeman Health began planning for a surge of patients that we believed would peak yesterday and remain with us for a period of 8 extremely challenging weeks. Thankfully, we didn't experience a high demand on our health system due to the quick action of state and local leaders and the great work of our community. I'd like to share 2 observations regarding those planning assumptions and why they were and continue to be important for us and our community. First, as our community begins its own phased reopening and as our neighbors begin to come back together, there is still a possibility that significant COVID surges may occur. We at Bozeman Health remain ready, and we continue to ask people to be vigilant, to follow the city-county health department guidelines, and to recognize that we are not yet through this community health crisis. And second, as Bozeman Health leaders, we believe it's always better to plan for the most challenging of circumstances and to be as prepared as possible as a healthcare organization to meet the needs of those that we serve. Anticipating the surge allows us to become exceptionally prepared. With increasing facility capacity, on-site testing, PPE, and the necessary medical equipment to respond. Ultimately, we believe that preparedness will serve us well as we maintain our readiness now and into the future. As we've designed our readiness and reopening plans, we've carefully considered how to move appropriately towards full operational capacity while continuing to be ready for widespread or clustered COVID-19 surges as the stay-at-home orders and business closures are lifted. Our phased approach remains in full alignment with the Gallatin City County Health Department and the Governor's Office recommendations. Throughout our COVID-19 response and in our preparations for our reopening, we continue to follow 3 priorities in our planning efforts. First, protecting the safety and well-being of our workforce, continuing to prepare for a surge of local COVID-19 positive patients, and third, supporting the efforts of state and local elected officials, our health department, and community leaders to continue to flatten the curve. Bozeman Health is proceeding with a deliberate phased approach to reopening on May 4th, and then coming to full capacity by June 1st. Currently, we are operating at approximately 25 to 35% capacity in our hospitals and clinics, which provides availability of up to 75% of hospital and clinic space and the essential resources to support our teams. These intentionally low volumes also allow for reserves of equipment, PPE, and staffing to potentially respond to a spike in COVID cases in the community. During phase 1 of our reopening from May 4th to May 17th, we'll increase services by approximately 25%, maintaining 50% availability of hospital and clinic space, supplies, and staffing. In phase 2, from May 18th to May 31st, we plan to operate at 75% of normal capacity, maintaining 25% availability of clinic space, supplies, and associated staffing. During the final phase, starting on June 1st, all Bozeman Health clinic sites will be at full operational capacity. Throughout our reopening sequences, we will monitor indicators that will help guide decisions towards the progression to the next phase. These include monitoring for a continuous reduction or no significant increase in confirmed new COVID cases in Gallatin County, ensuring on-site testing capability for approximately 100 tests per day during each reopening phase, achieving and maintaining a 30-day PPE supply, and maintaining staffing levels to provide high quality and safe patient care delivery. We'll also ensure sustainable hospital capacity, meaning that we will maintain availability of beds, ventilators, and essential equipment during each phase. As I shared earlier, our partnership and alignment with Gallatin City County Health Department directives will continue as we work towards reaching full operational capacity. We appreciate and understand the flexibility of the community at this time as we work through our phases. If you have an upcoming appointment, or if you had an appointment that was canceled, you will be contacted to confirm or reschedule the date and location of your appointment time. Additionally, since March 19th, 2020, we have increased our capacity for telehealth care, and that option remains available during the reopening phases unless an in-person visit is needed. Should you need to see a physician or provider in person, the following precautions remain in effect. Limited entry points at Bozeman Health Deaconess Hospital and Big Sky Medical Center, increased visitor restrictions in our hospitals and clinics, entrance screening for temperature, respiratory symptoms, and the purpose of your visit. We request that patients wear a cloth face covering or mask to appointments and in common areas of the clinic or hospital. You can find information on cloth face coverings on the CDC website, and we've also shared that information on the Bozeman Health social media channels. You're encouraged to contact your provider with any questions or to seek medical care. Please don't delay care, as we are here to ensure your health needs are met in a safe and timely manner. Bozeman Health's executive team and our COVID-19 Incident Command Response Team are incredibly proud of the care team members who continue to demonstrate leadership, compassion, and personal resilience during our COVID-19 response and beyond to these reopening phases. While we're not through this crisis yet, we are making significant headway, and there is light at the end of the tunnel. We wish to thank the entire community for their expressions of support, encouragement, and kindness. At this time, we'll open it up for questions, so if you would please unmute yourself, state your name, and which media organization you are with. We will try to handle and respond to your question.
Hello, my name is Rachel Louise Jess. I'm with ABC Fox. I just wanted to ask, what has been the greatest problem for you guys as a hospital in the last few weeks?
Yeah, thank you, Rachel. I'm going to do this. Callie Kujawa from our Incident Command, she's been leading our efforts, and I think she could share a few thoughts on some of our challenges that we've encountered over the last several weeks in preparation for our reopening. Callie?
Hi there, this is Callie. Yeah, I would say that the majority of our challenges that we have encountered during the reopening phase has consisted of successful management of our personal protective equipment, and as well as maintaining capacity in the event of a surge. There is so much that is unknown that we have had to pull from various sources to project volume increases and to model what perhaps the future looks like, so that we can make very detailed decisions surrounding personal protective equipment to keep both staff and the patients safe when they are in our facility. Additionally, it has been a challenge to continue to test patients. There have been varying literature, there's been varying literature and suggestions from the CDC as well as from local agencies suggesting who should and shouldn't be tested. So staying abreast of the testing recommendations and deploying those. Additionally, having access to tests as well as the turnaround time based on the availability of testing, which we've worked through and are continuing to work through. those two things really help, those two challenges really dictate a lot of our procedures and how we proceed with rescheduling patients and continuing operations.
Thanks, Callie. That was great. Rachel, hopefully that answered your question. I think I see a raised hand. Is that Gabriella?
Yeah, this is Gabby Kravit with KBZK.
Hey, Gabby.
Wondering within these phases that have been outlined, at what point patient visitation will resume?
I think I can go ahead and take that, and I'll also ask Vicki Grenowig to respond with any additional thoughts. At this point, we see through the reopening phases that will conclude successfully by June 1st if we've met all of our criteria, that we will maintain restrictions on visitors coming into our clinics and our facilities until we know that we are through these reopening phases. And so if we were to anticipate when visitor restrictions would be lifted, it would be in early June when we come back to our full operational capacity. Vicki, do you have any additional thoughts there?
I just think the one thing that I would add, John, and thank you for the opportunity, would be, yes, June 1st would be our target date, but we really are very cautious because as the state opens up more services and as our community opens up more services, we anticipate that there may be an additional cluster of patients. And if that's the case, we reserve the good common sense to back off and maintain our visitor restrictions, because we want to make sure that we can care for not only our staff and keep them safe, but also for the community members. So it would really depend on what kind of response we see in the COVID-19 virus as we open things up.
Yeah, thank you for that question. Other questions?
Hi, this is Catherine Houghton with the Chronicle. I'm wondering, as reopening is something that our community is looking toward, are there specific COVID-19 case numbers or case loads that would cause the hospital to delay the next phase, whether that would be statewide or based in Gallatin and close by counties?
Yeah, thanks, Catherine, for the question. And we'll go back to one of our first criteria, which is to ensure that we don't have a significant increase, but more specifically, we would like to continue to see a continual decrease in any type of positive test results that are coming forward in the county. We clearly are on a downward trend as we currently speak over the last 2 weeks, and so that's a positive indication for us to start our reopening plans. We also will look to Park and Madison counties to look at those numbers and to determine if they are starting to see increases in those areas. We do support those community hospitals and those community clinics, and so that could also help alter or perhaps inform a slowdown in our reopening phase. So we have a variety of valves or mechanisms by which we can reopen appropriately based on the number of cases that we're seeing, not only in Gallatin County, but throughout the surrounding counties as well.
Hi, so this is Catherine again. Thanks for that answer. Just a quick follow-up. I guess part of my curiosity is the fact that both state and health officials, including you all, have said that the expectation is there will likely be more cases as the state moves toward opening up. And so I guess my curiosity is what reaches that threshold where that's more than what was expected, or enough to slow down a potential phase in your reopening.
Yeah, thanks, Catherine. In the numbers that we've experienced so far, the greater majority of those positive cases are outpatient, so they have not put a demand on our healthcare system as we had initially thought. And so we do believe that we will start to see increases in our community. We're not quite sure what that will look like, but what will really inform our decision to slow our reopening is the demand on inpatient services. So if we start to see individuals who are sick, who require hospitalization, if we're starting to see greater demand on some of our clinics where those individuals are consuming more resources, care team time, we're working through and utilizing PPE more frequently, those are the key areas that we'll monitor frequently, if not on a daily basis, to determine if an increase in positive cases over the reopening phase will start to slow down our ability to care for a greater demand on our healthcare system. So, to summarize, we watch both the number of positive cases as well as those inpatient admissions and potentially patients who are coming to our clinics who are COVID positive. And those are the numbers or the monitoring values that we will watch closely. Any additional questions?
So this is Catherine again. Do you have an idea of kind of what procedures or surgeries will be prioritized? And sorry if I just missed this, but prioritized in the phased reopening?
Yeah, thanks, Catherine. We did not mention that specifically, but Dr. Williams, would you like to respond to Catherine's question?
Sure, John. Catherine, thanks very much for the question. There's been a lot of folks that have asked the same thing. Just sort of as a prelude to the answer, we will be testing all of our surgical patients for COVID using the regular PCR testing to provide additional safety for our staff and for the patients. We'll continue to take care of the trauma and the urgent cases, the OB cases that we've talked about. But when we get past that, we'll start looking at those cases in our oncology or cancer world that are very important for early diagnosis and treatment. We'll begin to look at those cases in which the patients have had functional limitations or pain. But over this whole process, we're following some guidelines put in place by the American College of Surgeons and the Centers for Medicare and Medicaid and other organizations to help us properly prioritize these patients. We've had some really good leadership from our surgical and nursing leadership in the surgical world, and we're watching this very closely, not only for the right priorities, but to make sure that we always have that reserve of PPE and testing supplies.
Thanks, Mark, for that. And thanks again, Catherine, for that question. Any additional questions?
I guess this is Rachel with ABC Fox again. I guess do you anticipate there being any more problems going forward that, maybe we've seen in other cities that we just haven't had get around to being here yet?
Let me open that up again to either Callie or Dr. Williams or Vicki. Do you see any concerns or additional problems that we haven't quite experienced at this point that we should be mindful of or that would need to be expressed in our conversation here today?
Yeah, John, if I can just make one mention of something we've talked about a lot, is that we've really benefited here in Montana from we've had these low numbers and low hospitalizations for several good reasons. One is we implemented, the governor and other leaders in the state and county implemented social distancing and other restrictions that really paid off. And with our influx of individuals, tourists into this community, the activity around summer, and people simply getting out, we have to continually remind people of the social distancing and hygiene and temperature monitoring. That's just, I don't think we can share that too much. So that's what I would offer.
Yeah, and Rachel, I would just continue to go back to the vigilance that we continue to monitor our testing supplies, whether they be the test kits or the reagents. We're constantly looking out into the marketplace for additional resources, as well as building up a stockpile, if you will, of testing supplies that we could use over the next several weeks, if not into the first part of the summer. But we also believe that creating stockpiles of our PPE and the testing supplies could also very much prepare the organization in the event that we see a resurgence during the fall. And so we continue to watch the procurement of other healthcare systems, the availability of these supplies out in the marketplace. And that's been our challenge over the last 5 weeks. It will continue to be the challenge that we will have during the reopening phase. But that really is what we keep our eye on, and we're trying to monitor as carefully as possible to make sure that we have all the needed supplies to care for our teams and for our community.
That answers my question. Thank you.
Thanks, Rachel. Gabby, I see your hand raised again. I'm not sure if that's from the first question or another question that you might have.
No new questions.
Okay. Any additional questions that we can answer?
This is Catherine again, just one last one from me. Say that all goes well in this buildup and Bozeman Health is able to make it through all of its reopening phases. If needed, how quickly can the hospital move back to kind of creating the space it needs if there is a potential surge down the road somehow?
Yeah, Catherine, that's a great question. Several weeks ago when we announced our surge plan, we were able to surge up at about a 35 to 40% capacity, which means that we could potentially move into areas of the organization where we could create critical care positions to treat patients on ventilators. And we believe that we could respond immediately to any demand that's placed in our hospital using current capacity, but it would take us probably anywhere from 7 to 10 days to really move beyond into what we would consider surge capacity. That surge capacity that we announced 2 weeks ago would allow us to take care of up to 135 to 138 patients in total. The other information that I think is important to know is that many of our construction projects that are associated with the master facility plan on the Deaconess Hospital campus, those will come online over the next 60 to 90 days. And we'll be monitoring very carefully any new cases or any demand on the healthcare system. And if needed, we could bring those new projects, the associated beds online to be able to treat patients well into the summer as well throughout the rest of the year. So we feel like we're in a good position to create additional capacity if it's needed from Bozeman Deaconess Hospital or even in Big Sky Medical Center, which you may be aware, we've added an additional 4 beds there. We're creating capacity within our emergency department. Those projects will be completed in the middle of May, if not towards the end of May. So we will continue to see the ability to increase capacity in the Big Sky community as well. Okay, any last questions that we may have? Dr. Williams, Callie, Darcy, or Vicki, would you have any last comments that you'd like to share with the group today?
Yeah, this is Mark. John, I'll just add that we're very thankful for everything that the community has done to manage this epidemic and to protect not only their own families, but our healthcare workers and teammates. So thank you. Thank you for that.
Thank you, Dr. Williams.
This is
All right.
Callie. I did want to give one last statement. My apologies, John. I want everyone to understand that we will also continue to liaise very closely with all of the local agencies to respond in a cohesive approach as well to meet the needs of the community.
Sounds great. Well, with those great last words, again, thanks to everyone for your time today, for your continued interest and support of Bozeman Health. And we hope everybody stays safe and healthy and well as we continue to get through this crisis. So thanks again, everybody. Have a wonderful afternoon.